Welcome to Spectacle on Television Nigeria. I am your host, Daniel Atai. Welcome to Spectacle on Television Nigeria. I am Daniel Atai. Today we'll be looking at the World Health Organization's warning that the COVID-19 pandemic may spread with fatality across Africa. But I have a medical expert on exclusive, and he shall be giving us the possible angle of solutions about fears of the novel virus. Please stay tuned, and when we come back, we shall also take a look around COVID-19 events that happened across the country in the last 48 hours. Welcome back. Before I introduce the exclusive with our medical expert, let's take a look at the trending stories of COVID-19 in the country, starting from the World Health Organization's warning. The W.H.O. Director General, Tedros Adhanom Ghebreyesus, didn't specify why he believes the outbreak that has infected some 2.5 million people and killed over 166,000 could get worse. He and others, however, have previously pointed to the likely future spread of the illness through Africa, where health systems are far less developed. Trust us, he said, the worst is yet ahead of us. Tedros told reporters from WHO headquarters in Geneva, let's prevent this tragedy. It's a virus that many people still don't understand, he said. Some Asian and European governments have gradually eased or started relaxing lockdown measures like quarantines, school and business closures, and restrictions on public gatherings, citing a decline in the growth of COVID-19 case count and deaths. Tedros and his agency have been on the defensive after President Donald Trump of the United States, the WHO's biggest single donor, last week ordered a halt to U.S. funding for the agency, alleging that it botched the early response to the outbreak, among other things. Trump insisted WHO had failed to adequately share in a timely and transparent way information about the outbreak after it erupted in China last year. Tedros said, there is no secret in WHO because keeping things confidential or secret is dangerous, is a health issue. This virus is dangerous. It exploits cracks between us when we have differences, he said. Tedros said U.S. Centers for Disease Control and Prevention staffers have been seconded to work with his agency, suggesting that was a sign of WHO's transparency. Having CDC staff at WHO means there is nothing hidden from the U.S. from day one, Tedros said. Our CDC colleagues also know that we give information immediately to anyone. In one of his starkest comparisons yet, the UN Health Agency chief also alluded to the so-called Spanish flu more than a century ago, saying the coronavirus has a heavy, dangerous combination, like the 1918 flu that killed up to 100 million people. Tedros called the illness public enemy number one and said, we have been warning from day one. This is a devil that everyone and everybody should fight. And then we move on to another good story making rounds in the country where the federal government had to apologize to the country over the conduct, the protocol lapses at Abba Kyari's burial. The federal government apologized 2 days ago for the lapses and the violation of COVID-19 safety principles and protocols that occurred during Saturday's burial of the Chief of Staff to President Muhammadu Buhari, Malam Abba Kyari, in Abuja. It also cautioned Nigerians against undue optimism over when the COVID-19 pandemic would end, assuring them, however, that it it was striving to overcome the virus, which cases rose to 665 in 2 days' time, with about 188 patients discharged, while 22 persons dead so far. And the federal government said as part of the renewed efforts to combat the pandemic, it had developed a new action plan to tackle the spread of the virus, adding that it would evacuate Nigerians living abroad by next week. Besides, the federal and state government yesterday gave updates in their effort at combating the virus, with Edo and Ondo State announcing the discharge of their index cases, while Lagos State said from next week it would make the wearing of face masks compulsory in the public. Meanwhile, no fewer than 8 private hospitals have suspended operations in Lagos for 2 weeks, apparently to allow for the rectification of their facilities after treating COVID-19 patients, in some cases unknowingly. At a press conference in Abuja, chairman of the Presidential Task Force on COVID-19 and Secretary to the Government of the Federation, SGF, Mr. Boss Mustafa, and the National Coordinator on COVID-19, Dr. Sani Aliu, apologized on behalf of the federal government to Nigerians over the lapses at Kyari's burial. Mustafa listed some of the violations which the Presidential Task Force had regrettably observed, to include failure to follow the guidance provided on mass gatherings, social distancing, personal hygiene, and restriction of movements. The PTF recognizes regrettably the unintentional violation of the principles and protocols that form the core of our messaging to Nigerians at the funeral of the late Chief of Staff. These principles for emphasis include the guidance provided on mass gatherings, social distancing, personal hygiene, and restriction of movement. Lessons have been learned, he said, and appropriate measures have been taken to close all gaps. We assure all Nigerians of their safety and the determination of PTF to combat the pandemic, he stated. Mustafa added that the development had renewed the resolve of the task force to remain focused on the response to COVID-19 in honor of the late Chief of Staff and other diseased patients. On the call that all members of the task force that attended the funeral should self-quarantine, the SGF said, "I want to assure Nigerians that we are responsible people with family members. We have children, spouses, and our friends like you. We won't do anything as a PTF to put you at risk." That was what the SGF, the Secretary to the Government of the Federation, Boss Mustafa, said as regard their own measures to curb the COVID-19 pandemic. Meanwhile, FG has also insisted that corpse of COVID-19 victims could not be infectious. Ali also apologized to the public for the blunders at Kyari's funeral, which had put the FCT residents at the risk of the contagion. He said lessons had been learned from the experience. Aliyu said the burial ground had been decontaminated, while the protective equipment of one of the undertakers that was dumped at the site had also been decontaminated and discarded according to the NCDC guidelines. Contrary to the allegations in the social media, Kyari corpses was properly prepared for burial according to NCDC guidelines. At this juncture, let's get to watch the exclusive with Dr. Iheme Ogbonnaya, a family physician, to speak to us about the prediction of the World Health Organization and possible solution to COVID-19, as it has been uncovered that the pandemic is not a death sentence after all. Yeah, on Spectacle today is a consultant family physician, CFP, Dr. Iheme Ogbonnaya. Welcome to Spectacle.
Thank you, Daniel.
All right. He's a medical director of a Prime Care Hospital, Gwarimpa, in FCT here. Doctor, you heard the prediction or the statement of the WHO boss in the person of Tedros Adhanom Ghebreyesus, predicting that the escalation of the coronavirus pandemic will be much and severe in Africa. What do you think prompts this prediction or presumption?
All right, thank you very much. His prediction is not out of place, first and foremost. I know WHO has been like in the forefront of health, protection of health all over the world. That's actually their basic, their watchword. Now, they are not just involved in researching, they're also advisory, and as much as possible, they help to develop policies, health policies that are uniform, standard all over the world. Now, somebody as eminent as the Director General of WHO, Dr. Tedros, to come up with such a statement is worrisome.
Okay.
Now, why it is worrisome is because there is actually a precedent. Probably he has been following a trend. He has been following that made him come up with such a prediction. Africa, for some time now, has been in the front burner, even before the onset of coronavirus. You know, where you have issues to do with poor health management, poor healthcare services. They have over time refused to improve their healthcare delivery system. They have over time refused to dedicate the minimum percentage of the budget that has been supposed to be exposed to healthcare. It is a place, it is a part of the world that is bedeviled, riddled all forms of diseases, poverty, ignorance, sickness, corruption, and all kinds of lack of political will to improve the situation on ground. Now, the leadership in Africa as a whole has failed, in the sense that they have refused to muster the necessary political will to improve the quality of healthcare over time. They are more interested in fleecing the wealth of their countries. Now, that has put us where we're talking about absolutely very poor healthcare management.
So all the while, you mean the percentage from the budget has
never met the standard right from the inception. We're not just talking about Nigeria now, we're talking about all over Africa.
How many percent should
now,
be?
WHO puts it at between 5 to 10%.
Okay, of the national budget.
National budget.
Into health.
Now, you can be sure that a lot of us, you see a lot of places where you see some governments are dedicating just 1% of their budgetary provisions to health. Now, with that background, WHO is very correct. That's why I said his assertion is not out of place. Now, he is looking at a situation whereby very highly developed nations, medical resources and all whatnot, like you have in the first world, the developed countries, they are presently reeling under the effects of coronavirus. You have a situation whereby I'm talking about over, like in the United States, where like we always like to use as the pointer, you have over 799,000 infections and over 42,000 deaths in record time. Now, we are looking at a situation whereby a country like that, which we always want to use when we are comparing standards, if a country like that, coronavirus could put them to shame, literally speaking, with all their technological know-how in the medical field. Now, one now ponders to understand what will happen when corona comes into full force in these other countries, African countries, the so-called developing nations, where we have just mentioned the ills. In addition, we're talking about poor political will. We're also talking about where you have overcrowding, poor housing facilities, and so on, illiteracy, poverty, hunger, and so on and so forth. Now, you are looking at a situation whereby if this kind of sickness, which we know how easily it is transmitted, it's not like other sicknesses that you really have to go out of your way to get infected. Talking about the other viral components.
Yes.
This one can easily be spread by as much as respiratory droplets. Okay. You don't have to have contact literally with the person. You don't have to exchange blood with the person, just respiratory droplets, which can easily be spread even by talking. Now, to tell you, if it is that easily spread, so one can now imagine with all these indices we've mentioned in these African countries, the preceding indices we mentioned, what the effect will be. So that's why I don't think Dr. Theodorus is out of point saying such statements. It should actually be a wake-up call to the leadership in most African countries.
Okay, and now so far across the world we have recorded about 2.5 million infection across the world and about 166,000 deaths, out of which US shares the lion's share right now.
Yes.
And China, Italy.
Yeah.
Do you see that despite this lockdown, do you still see the possibility of the spread like the WHO director is saying?
Yeah, the fact is there is a lockdown, by pronouncement, but in reality, is it actually a lockdown? So that is actually the question I will want us to answer. Now, His Excellency, the Commander-in-Chief, in his own wisdom, has announced a lockdown. This is actually the third week. Now, we are looking at 3 states were actually involved by the federal government. Talking about FCT, talking about Lagos State, and Ogun State. Yeah. Now, other states have also introduced their own levels of lockdown. All right, more of like preventary, but those ones are from their own state governments. Now, the question is, if you take a cursory look at these states in question, FCT for instance, where we operate in, now you go around. A lockdown is supposed to be, in ideal climes, lockdown means there is no movement, there is no interaction, there is no contact, there is enforced social distancing. Now, while these things are going on, people are also encouraged, apart from essential services, which have been widely stipulated. Now, while these lockdowns are also going on, the government is also supposed to play their own part to encourage these individuals to also observe the lockdown itself. Now, they are supposed to, as much as possible, come up with palliative measures, all forms of food relief and so on and so forth. Well, I'm sure we are still going to get there very soon. But the fact is, the lockdown as presently is in Nigeria we still have a long way to go. So a situation whereby we say there's a lockdown and you still see people, okay, probably there's a reduced in vehicular movement. Now, how about people who are strolling? Are they not under lockdown? If you drive along the road now, along our roads in FCT, you see a lot of human movement. Now, the problem we have at such a situation is we think there's a lockdown. But now, these people are still moving. At any point, any time of the day, it should have been a total thing. They move during the morning, in the afternoon, and at night. Some are in the guise of exercising. Some are, jogging together, holding hands. There is no social distancing. So that's why my fear in that scenario is that the lockdown, yes, being well-intentioned as it is, the government has a good intention by so doing. But now the implementation is still not 100% as we expect it to be. Now, in the city center, you could see some level of compliance, which is commendable. Apart from the human traffic, the movement we're talking about. Now, if you go to the suburbs, places like Lube, places like Nyanya, Maraba, you will see that there is little or no compliance. So the question now is, even if you are achieving some level of control, flattening of the curve in the city center, what happens in the suburbs? Are these not Abuja? So that's why one will still not be surprised that these rates will keep increasing, even with the lockdown.
And do you think that what W.H.O is saying is a coincidental statement with that of Bill Gates and Melinda Gates, especially predicting much death in Africa? Then I will now ask you to tell us more about the contagious nature of COVID-19 that we are so much afraid of, that the whole world is locking down.
Okay. Thank you very much. The statements, even though I know a lot of people are really meaning into it, the statements are still valid. whether from Bill Gates, from Melinda Gates. I've been reading about some on social media, people who have been talking about involvement of Bill Gates in getting vaccines that will reduce the population. Well, I don't think with the kind of level he occupies in society, especially in the international world, I'm not sure Bill Gates will actually subscribe. This is somebody who is a lot into philanthropy, improvement of health indices. I mean, his foundation, the efforts they are making, especially to eradicate polio single-handedly. So I still want to disbelieve such assertions. People trying to ascribe him with such negative connotations to a statement he made, which are ideally statements of facts. So before we become emotional, because we become sentimental in interpreting such statements, we really need to understand the import. We need to understand where we operate from, the continent we find ourselves, the indices we are battling with, we are grappling with, which over the centuries, over the decades, have not simply improved. So I think anybody who is making such statements, instead of us to call for his head, it should be a wake-up call for us to look inwards and then decide after the after the COVID-19 must have been eradicated finally. Decide that enough is enough. Let us move from where we are, instead of being the laughing stock of the world, and we have what it takes. We have the potentials, economically, manpower, whatever you want, whatever you mention, however you want to go about it. We have the manpower, we have the potential to be up there with other parts of the world. So I think in this low period of Africa, this is time for us to go inwards, do some level of introspection into those statements instead of being sentimental about them, and see how we can improve on them. Be more oriented, science and research oriented. Be more concrete, more concrete and abstract thinking. I think that will take us to a higher pedestal than for us to always want to be the crybaby. Play that victim mentality that we always do.
Back to the second question. The contagious nature of this COVID-19. I hope you are aware of it.
Yes.
And tell us more about this COVID-19 that is spreading exponentially and in geometrical progression.
Now, coronavirus has always been with us, right from time immemorial.
Has always been with us.
Has always been with us. But the particular strain we call COVID-19, the one causing the COVID-19, actually the real name is supposed to be SARS coronavirus 2.
Okay.
Now, SARS there meaning severe acute respiratory syndrome.
Severe acute respiratory syndrome.
Coronavirus 2.
Okay.
That's the one that is responsible for the particular one we are having. We have had other SAR viruses before.
SARS virus, like MERS.
The one we had before, and the one. But just that the only issue with this one is it is a new virus. Other ones have been known over time. Vaccines developed, treatment developed, very much understanding had about them. But this one was first discovered somewhere in China, 1st of December 2019. First discovered. In fact, that was why they now call it the novel standing for new.
Okay.
Coronavirus. It has not been known to mankind before now.
So what is new about it?
Now, the new thing about it is just like others who cause severe acute respiratory syndrome, the difference now is that it's more virulent. In other words, it causes more morbidity and more fatality. Then 2, much information is still lacking. Much information is still not known about it.
But much solution has been recorded in China.
Now, China, China, we also have to understand China from the context of their communist lifestyle. Okay. China, up till now, we have still not come up with what exactly China did. Now, a lot of assertions have been made. A lot of people have mentioned the use of antiretrovirals. They are employing antiretrovirals.
HIV drugs.
Yeah, antiretrovirals. Okay. All right. They're using to achieve